The next developmental disturbances of salivary gland, that is Stafne cyst. These are some other names for Stafne cyst, that is Stafne bone cyst, lingual mandibular salivary gland depression, latent bone cyst, static bone cyst or static bone defect, and lingual cortical mandibular defect. Then coming to introduction, in 1942, Stafne described a series of asymptomatic, there is no symptom, there is no pain, radiolucent lesions located near the angle of the mandible. The condition represents a focal concavity of the cortical bone on the lingual surface of the mandible. There is some depression or concavity which is present on the lingual surface of the mandible. In most of the cases, biopsy has revealed histologically normal salivary gland tissue. In the radiograph, you see there is a radiolucent lesion or black color, and after biopsy it revealed normal salivary gland tissue. That suggesting that these lesions represent developmental defects that containing a portion of the submandibular gland. A few of these defects or the Stafne cyst reported to be devoid of contents or to contain muscle fibers, fibrous connective tissue, blood vessels, fat or lymphoid tissue. Sometimes similar lingual cortical defects which are present anterior to the mandible in the area of the incisor, canine or premolar teeth, that is mostly present on the anterior region. These anterior defects are related to sublingual gland. If the defect is present on the posterior part, then that was related to submandibular gland. If it is present on the anterior part, then it is related to sublingual gland. Then clinical and radiological features. The classic Stafne defect or Stafne cyst presents as an asymptomatic radiolucency which is present below the mandibular canal in the posterior mandible, and it is present between the molar teeth and the angle of the mandible. In this picture you see there is a radiolucency which is present here below the mandibular canal. This is the mandibular canal which is running, and there is a radiolucency which is present below the mandibular canal, and it is present between the molar teeth and your angle of the mandible. The lesion is typically well circumscribed and has a sclerotic border. Sometimes the defect may interrupt the continuity of the inferior border of the mandible with a palpable notch observed clinically in this area. Most Stafne defects are unilateral, although bilateral cases may be seen. In the last slide, I am discussed about posterior lingual defect. In this slide, I will discuss about the anterior lingual defect. Anterior lingual salivary defects that present as well-defined radiolucencies that appear superimposed over the apex of the anterior teeth. This is the anterior area. There is a radiolucency which is present below the apex of the anterior teeth. This is the anterior lingual salivary defect and having a male predilection. Posterior Stafne defects are not rare, and posterior defects they have been reported in 0.3% of panoramic radiographs. Coming to age, Although the defect is believed to be developmental in nature, it doesn't appear to be present from birth. Most cases occur in middle-aged and older adults, with children rarely affected. This implies that the lesion usually develops at a later age, that is around your middle to older age. Stafne defects typically remain stable in size, and that's why the name suggests that static bone cyst. These Stafne defect or the Stafne cyst, they are also known as static bone cyst. Why? Because it typically remains stable in size. So it is also known as static, means constant bone cyst. In a few cases, if the lesion has increased in size over time, this indicates that these lesions are not congenital. In the picture you see, in the first picture, there is a fainted radiolucency. You can see here. There is a fainted radiolucency below the mandibular canal. In the same patient, after some years, the radiolucency has increased in size, right? It increased in size over time, so it may not be congenital. The diagnosis can usually be made on a clinical basis by the typical radiographic location and lack of symptoms. If the clinical diagnosis is in doubt, it can be confirmed by CT scans, MRI or cyalography. CT scans and MRIs show a well-defined concavity on the lingual surface of the mandible. In the picture you can see it's the CT scan of the mandible. There is a concavity or a depression that are present on the lingual surface of the mandible. Cyalograms may be able to demonstrate the presence of salivary gland tissue in the area of the defect. Then histopathological features or features you can see under the microscope. Because of the typical radiographic appearance, biopsy is usually not required to establish the diagnosis of Stafne defect of the posterior mandible. If biopsy is taken, then it revealed normal salivary gland tissue, mostly submandibular gland. Some defects are devoid of tissue, or it may contain muscle fibers, blood vessels, connective tissue or the lymphoid tissue. Then treatment and prognosis for Stafne cyst. There is no treatment is necessary for patients with Stafne defect of the posterior mandible, and the prognosis is excellent. Biopsy may be necessary for anterior lingual salivary gland defect to rule out other pathologic lesions. Sometimes a complication reported in the literature, that is the development of a true salivary gland neoplasm with one of the cortical defect. Because anterior lingual salivary gland defect may be difficult to recognize, for that you have to take a biopsy to rule out other pathologic lesions. So these are all about Stafne cyst or Stafne defect that are present at the angle of the mandible, which represent the normal salivary gland tissue. I hope you like this video. Please like this video and subscribe to this channel. Thank you so much.